Hello, welcome to Advancing Health Literacy, Improving Written Communication for Clinical Settings. This is the second in a series of trainings brought to you by the New Haven HEAL Initiative. The New Haven HEAL Initiative aims to improve health outcomes for New Haven residents, to reduce COVID-related disparities, and to increase patient engagement in their healthcare. To refresh your memory, health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health related decisions and actions for themselves and others. In the last training, we went over how to form a health literacy team, how to create a plan, raising awareness, clear communication, the teach back method, following up with patients, improving your telephone system, brown bag medicine reviews, addressing language differences, and considering culture, customs, and beliefs. If you take a look at the poster on the right, you'll see a pretty old example of how health information used to be communicated to the public. We've come a long way since then, and today there are a number of strategies that can be used when creating health messaging. During today's training, we'll be going over a few tools you can use to improve written communication at your organization. Tool number 11 is assessing, selecting, and creating easy to understand materials. The first step is to identify key members to join. Practices often ask patients to fill out forms or provide them with written materials to read. With 36% of the US adult population having limited health literacy skills, it is likely that many of your patients don't understand all of the written materials they receive. Assessing, selecting, and creating easy to understand forms and educational materials can help you improve patient comprehension. Train a staff member to evaluate the quality of the materials you give to patients. Have at least one person in your practice learn to assess the materials you distribute. Focus first on important and frequently used materials, such as your lab results letter, after visit summary, appointment reminder, or fact sheets about managing chronic conditions. Be sure to review materials developed by your practice as well as materials obtained from outside sources. Assess whether patient materials are easy to read and understand. There are numerous methods for assessing patient materials. Some approaches focus on how readable materials are. Others examine a broad array of features that can make materials easy to understand. You should use both types of methods in assessing your materials. Readability formulas focus on the length of the words and sentences in a document and provide an estimate of how difficult text is to read. Several websites are available for conducting readability assessments using commonly used formulas, including the Frye formula, SMOG, and Flesch Reading Ease. Search the internet for readability formulas to find free online resources. In most cases, these sites indicate the grade level at which a patient would have to read to understand the material. The average adult reads at the 8th or ninth grade level, and 20% read at the 5th grade level or below. Therefore, to ensure wide understanding, it is best for materials to be written at the 5th or 6th grade level. Several methods are available to examine features of patient materials other than readability that affect understanding, such as word choice, organization of information, and formatting. The AHRQ's Patient Education Materials Assessment Tool, PEMAT, can help you assess written and audiovisual patient education materials. It provides separate measures of how easy materials are to understand and to act on. The CDC's Clear Communication Index assesses the clarity and ease of use of written materials, particularly those with behavioral recommendations or those that communicate information about risk. The Suitability Assessment of Materials, SAM, assesses the suitability of health information materials, including how well materials stimulate learning and how culturally appropriate they are. Ask patients to evaluate your forms and other written materials that you hand out or are available on your patient portal. Include both materials that you developed and those you obtained from external sources. Watch out for numbers. Ensure that your materials follow recommendations for improving communication of health-related numbers. Provide only the information patients must have to make informed decisions. Provide patients with numbers, not just verbal descriptors. Use simple graphics to express numbers. Provide absolute risk rather than relative risk, especially when risk reductions are small. Express the risk benefit in whole numbers, not fractions, decimals, or percentages. Use consistent denominators to facilitate comparisons and prevent confusion. Present risk in terms of a time span that is meaningful for patients, such as a 10-year period rather than a lifetime. Choose or make materials that are easy to understand. Identify poor quality materials. Identify materials that performed poorly on your assessment. Working with your health literacy team, consider whether these materials can be modified or whether they will need to be replaced. Select better materials. When you identify deficient materials that cannot be revised, search for new ones. Consider alternatives to written materials. As 1/5 of adults read below the 5th grade level, it is best not to rely too heavily on the written word. Audio and video resources, as well as talking in plain language, may be better for many patients. Use the internet. There are many free health educational resources available on the web which contain interactive tutorials. Assess all new materials using the tools, and when directing patients to a website, be sure it has a simple navigation and is easy to read and understand. Provide materials in languages your patients speak. Making easy to understand materials available to your non-English speaking patients can be helpful. Create new materials to fill gaps and revise homegrown materials that need improvement. Sometimes you just can't find easy to understand instructions or information you want to share with your patients, or you realize that the materials your office has created are not as easy to understand as you'd like. Some approaches to creating new materials are to use a guide, streamline your forms, involve patients in the process, consulting a lawyer for legal advice, and obtaining the necessary approvals. Be sure to track your progress on all efforts made. Tool number 12 is using health education material effectively. Health materials are effective only when used as part of an overall patient education strategy. Simply handing patients a pamphlet or referring them to a website is not enough to promote understanding or behavior change. Don't assume that your patients read the materials you give them or direct them to. If the information is critical, make sure you or someone in your office reviews the information with your patient and/or the patient's caregiver. When reviewing a handout, circle or highlight the most important points as you talk about them. Personalize the material by adding the patient's name, medicines, and/or specific care instructions. Use the teach-back method to confirm understanding. Emphasize the importance of the material by referring to it during follow-up phone calls, emails, and future office visits. You may need to give the material to the patient more than once. Ensure patients know how to use audiovisual materials or access the internet. If you give patients DVDs or refer them to websites, make sure that they have the appropriate video equipment, internet access, and the know-how to view or access these materials. Like written materials, you can't assume that your patients will view audiovisual materials or visit websites you recommend. If the content is critical, be sure it gets communicated in person. Always have a conversation with patients after they view audiovisual materials. Decision aids and tutorials can save time but are a supplement to, not a substitute for, a discussion and checking understanding. Train patients to use the patient portal and to be discerning consumers of internet content. Even patients with excellent health literacy skills may have limited computer skills. To ensure that patients are able to access your patient portal, arrange training sessions to show patients how to get online and retrieve information from the portal. If patients are surfing the internet for medical information on their own, you may want to educate them on how to find accurate health information. Obtain patient feedback on materials. When following up with patients, ask whether they found the materials helpful. This can allow you to emphasize the importance of the materials, review any questions patients may have, and obtain input from the patient about the materials provided. Manage educational materials. Monitor and organize any materials you distribute regularly to ensure you know the type and amount of materials you have, can easily locate them, and know when you need to update or restock them. Update your list of easy to understand materials available through your patient portal. What is available may change rapidly. If materials are accessed via hyperlinks, check frequently to confirm that the hyperlinks still work. Create an information order set. Have someone in your office assess electronically stored materials and identify the best ones. Then create information order sets for commonly used materials. For example, you might create an order set of materials to give to patients newly diagnosed with a chronic condition or who are starting a new treatment. Order sets can also be made available through the patient portal. Ensure staff know what educational materials are available, where they are located, both physically and or in the patient portal, and how to use them effectively. Remind staff on a quarterly basis. As always, track your progress. Tool number 13 is welcoming patients, helpful attitude, signs, and more. Do your patients feel welcome when they enter your practice? Have you clearly identified how to get to common locations like the restroom or the checkout desk? Do patients face a barrage of paperwork when they first come in? Some patients may feel anxious or intimidated when navigating a practice. This may be more problematic for new patients and for those with limited health literacy. Creating a friendly and easy to navigate environment may help your patients feel welcome and relaxed. First, assess your practice. Shadow patients or conduct a walkthrough. Review signs throughout your practice. Check with your clinic administrator to see if a review and approval process is required to change signs in your practice. Look at all the signs in your practice and make sure they are visible and easy to read, provide clear direction, and are written in appropriate languages. Be sure to use graphics when appropriate. Consider other approaches to help patients find their way, such as color-coded lines on the floors or walls. Next, you'll want to train staff. First impressions count. The first person a patient talks to should be helpful and cheerful. Use the guidance in this tool to train front desk staff on how to create a helpful and health literacy friendly atmosphere for your patients. Don't forget the back office. Patients with billing questions often find it difficult to understand procedure codes and insurance practices. Teach your staff to provide easy to understand explanations of common billing and insurance concepts that avoid technical jargon. Be sure to see tool number 3, raising awareness, tool number 4, communicating clearly, and tool number 7, improving telephone access for additional guidance on training staff. Offer everyone help with forms. You can't tell by looking which patients may need assistance, so offer all patients help with the forms that they are asked to fill out or sign. Offer help in a friendly, non-stigmatizing way. For example, I am going to give you these forms to complete. You can fill them out now or wait until you get to the room and the assistant will be happy to go over them with you. If anything on the form is not clear, let me know and I'll be happy to go over it with you. Make sure information collected from patients is shared with everyone who needs to know, so the patient is not repeatedly asked for the same information. Assess language preferences. Ask patients about their language preferences and provide appropriate language assistance services. Refer back to tool number 9, Addressing Language Differences, for further information. Create a practice brochure. Use tips from tool number 11 to develop an easy-to-understand brochure highlighting key elements of your practice, such as contact information, including after hours and emergency information, services provided, the address and directions to your office, and what to bring to appointments. Use the waiting room to display important information. Use the space in your waiting room to share important information, but don't overwhelm patients with too much material on walls or tables. Display posters to raise awareness about your practice's quality improvement work and to educate patients about important concepts such as asking questions, reviewing medicines regularly, and the importance of remembering to take medicines correctly. Display photos of practice staff, including names, titles, and key responsibilities, to help patients better understand the roles different staff members play. Remember to use simple words. Use bulletin boards as focal points in your lobby to arouse patient interest, stimulate thought, and encourage action. Provide easy to understand patient education materials. Make sure written patient education materials in your waiting room are easy to understand and read. Rather than providing numerous pamphlets, select those materials that are most relevant to your patient population. Lastly, use video and television programming. In the end, ensure that all materials displayed in your waiting room are targeted at your audience, organized around a central theme, contain no more than 4 points of interest. They're easy to understand and colorful, and that materials are updated regularly. Assign staff to update content on a regular basis. Lastly, track your progress. This concludes today's training on improving written communication. Be sure to try these tools out. This training is brought to you by the New Haven Health Education and Literacy Initiative, led by the New Haven Health Department. Join us for our next training coming soon on improving self-management and empowerment.